Are you really aware about your body condition? Well then, let's find out. Aphasia is a communication disorder that results from damage to parts of the brain that contain language. Patients with Broca's aphasia are able to write, to read, to listen, and to understand people, and are able to talk, but not able to form any coherent word. The condition is the result of an injury to Broca's area. Aphasia is most often caused by stroke. However, brain tumors, traumatic brain injury, and progressive neurological disorders can also cause aphasia. Signs and symptoms: difficulty producing language, difficulty understanding language, difficulty reading and writing. Batten disease, a rare genetic condition that's part of a group of progressive degenerative neurometabolic disorders known as neuronal ceroid lipofuscinosis. Currently, it can't be prevented and it is fatal. The disease causes lipopigments, which are fats and proteins, to abnormally build up in the body's tissue. Seizures, visual impairment or blindness, personality and behavior changes, dementia, loss of motor skills, and the ability to walk, talk, and communicate. Huntington's chorea, a rare inherited brain disease that occurs in 1 out of every 10,000 people in the U.S. The Huntington's Disease Society of America states that an affected parent has a 50% chance of passing the gene on to the next generation. Often, this disease starts in people between the ages of 30 to 50, and is a progressive loss of the basic autonomic functions in the brain, such as movement, swallowing, and breathing. There is no cure for this disease and no set rule as to when it will start. Death is usually caused by the lack of ability to care for oneself anymore, infections, and choking due to the inability to swallow.
Prolapsed uterus. Your uterus or womb is normally held in place inside your pelvis with various muscles, tissue, and ligament. Because of pregnancy, childbirth, or difficult labor and delivery, in some women, these muscles weaken. Also, as a woman ages and with a natural loss of the hormone estrogen, her uterus can drop into the vaginal canal. Muscle weakness or relaxation may allow your uterus to sag or come completely out of your body in various stages. This degree, the cervix drops into the vagina. On the second degree, the cervix drops to the level just inside the opening of the vagina. On the third degree, the cervix is outside the vagina. And on the fourth degree, the entire uterus is outside the vagina. Following conditions can cause a prolapsed uterus: pregnancy or childbirth with normal or complicated delivery through the vagina, weakness in the pelvic muscles with advancing age, weakening and loss of tissue tone after menopause, and loss of natural estrogen, conditions leading to increased pressure in the abdomen, such as chronic cough, straining, pelvic tumors, or an accumulation of fluid in the abdomen, being overweight or obese with its additional strain on pelvic muscles, major surgery in the pelvic area leading to loss of external support. Testicular cancer. It is a disease when testicular cells become abnormal in one or both testicles. It is the most common cancer in 20 to 35 years old men. The exact cause of testicular cancer is not known, but risk factors include undescended testicle, congenital abnormalities, and history of testicular cancer, and being white. Testicular cancer is often first detected by the patient discovering a lump or swelling in a testicle. Other symptoms include testicular pain or discomfort, testicular enlargement, aches in the abdomen, back or groin, or a fluid collection in the scrotum.